Greetings and welcome to another episode of Potpourri. I'm your host, Ariel Benton, and today we have with us Dr. Pamela Roshell. She's the Regional Director of Region 4 of the U.S. Department of Health and Human Services. Let's welcome Dr. Roshell. Now, thank you for being with us today.
I am so delighted to be here. Thank you for this invitation.
Wonderful to have you. I'm so excited to learn about what you do and how it applies to me as an American citizen and as a citizen of Georgia now.
Yes.
I work here and I go to school here, so I'm definitely thinking about making Georgia my home later. So I want to know what you have, what position you play a part in as far as me being a citizen and living here in the state.
In the state. Well, I'm so happy that you asked me that. The Department of Health and Human Services, the U.S. Department, we are the federal agency that is responsible for the health and safety of all Americans. So we have responsibility for the Food and Drug Administration, for CDC, the Centers for Disease Control, for Medicare and Medicaid services. So we touch your lives in a variety of ways. We touch your insurance, your food, emergency preparedness. So we really are responsible for making sure that your health is intact from a quality and a cost standpoint, as well as all of those other issues that I mentioned.
Wonderful. So you just control things that will help us do better.
Exactly. Improve health for all Americans.
Wonderful. So I did hear you mention about Food and Drug Administration. So does that dibble and dabble into our pharmaceuticals and things of that nature?
We do things like food testing, any issues related to labeling, so a host of issues related to our food. And my primary responsibility at Health and Human Services, I am a presidential appointee, and so I was appointed to this position by President Obama in July, and I am primarily Secretary Kathleen Sebelius's key representative in 8 states. So our region covers 8 states, including Georgia, and we work with a host of agencies and stakeholders, tribal leadership, and state governments and other organizations to help them understand. Right now, our priority is the implementation of the Affordable Care Act, and so that is the primary issue of concern for us right now, making sure that they understand what the benefits are, how this law impacts them and the citizens here in Georgia and across the whole region.
So when you say tribal governments, do you mean people of Native descent?
Absolutely, absolutely. We cover, in each region, we have responsibility for tribal nations. And so, for example, we just did a visit with the Catawba Indian Nation in South Carolina. And so, yes, we have 6 federally recognized tribes here in our region. And yes, they're included in our work.
That's so wonderful to know. I never knew about that aspect of our government. It's wonderful to know that we are reaching out to all types of people, even within our own country.
Yes, yes, it's a very important aspect of our work.
Wonderful. So what would you say is the most exciting part of your job?
I would say the most exciting part of my job is being responsible for implementing policies that impact millions of Americans. For example, the Affordable Care Act, as you know, is improving the health and affordability and quality of health care for many Americans across this country. And so that is the most exciting part, really seeing the law and how it really impacts Americans and makes life better.
So how hands-on are you with these different policies that go through? I know the Affordable Care Act is a new law, so just how hands-on are you and your department with that?
Well, once, for example, using the Affordable Care Act, we're not involved in my organization, the regional office. We're not involved in advocacy. We are the implementers. So we help individuals understand the regulations. We help them understand the policies and how those policies impact them. So we're on the other end. Once the law, once the policy or bill becomes law, then we're responsible for engaging stakeholders to help them understand how to make the most out of it so that it is something that really does improve their life.
Okay. So I heard you mention earlier that you were appointed by President Obama.
Yes.
A presidential appointee is a huge resume booster, but I'm sure you had a long list of different accolades that you could bring to the business. So what was your background like before this?
Absolutely. Thank you for asking that question. My background has been in health policy and in gerontology and public administration. As a matter of fact, I received my doctorate right here at Clark Atlanta.
Oh,
you know, I had to get that in there.
Yes.
And which was really a tremendous help with my whole career flow. I have been working in the arena of public policy and healthcare administration for about 20 years now. And so all of that definitely helped me to position myself for this opportunity.
Wonderful. So that background started even in your educational days.
Absolutely, yes. My undergraduate is in public affairs, which is really a nice combination of government, public policy, and administration. And then my graduate degree from the University of South Carolina is in social work administration, which is more public policy, more administration. So I've always recognized policy and administration as something that I had a passion for, even though I didn't know as a young child that that's what it was called. But the career path has taken me there, with, of course, the help of the Holy Spirit and my spiritual connection. Wonderful. So all of that together has led me to this place.
Wonderful. I often think back on different career fields and opportunities, fields of study here at my university, and I wonder why some people choose the different options that they have. And you said even as a child you were thinking about this, you didn't know what it was called, but this was something that you were very passionate about. How do you obtain a passion for something like this? I know it's policy, so there's got to be a lot of research, a lot of writing, a lot of meticulous editing and correcting, and you said regulations. You have to really spell those out for people to understand. How does somebody develop a liking for that?
Like, who would like that? I think back to exercises like, you do the brain analysis, and whether you're analytical or whether you're touchy-feely. And so my whole makeup and what I like and what I'm interested in has always been around analyzing something. Why does it work the way that it works? Can it work another way? What's the best solution for whatever it is? What's the best way that our lemonade stand should run? We need a policy for that. We just can't go willy-nilly and set up the lemonade stand. As a child, I was the one who said, okay, I need to know exactly how we're going to operate the stand, who's responsible for what. And some of my other friends are just, let's just put the stand up and go. So they're innate pieces of your personality that really are cues to you as to what you're graced to do. And you really should follow what you're graced to do, because it makes your work so much more effortless from a standpoint of just loving it and having a passion for it.
So you said that you were able to just spot these things out. You had a very critical mind. What have you been able to analyze in your years in the field about American society?
Well, one thing that I've analyzed from the standpoint of gerontology, which is one of my areas of specialty, is that many times Americans don't like to think about growing older, for example. And so as a consequence, we put off planning for growing older. And the manifestation of that is that we end up in older age in crisis. We haven't planned for who's going to take care of us. We haven't planned for financially living until I'm 90. So that has been something that I've realized, that we need to message the value and the beauty of growing older so that Americans think about it in a positive way and plan for it. Because if you're lucky enough, if you're blessed with longevity, you will grow older, or you'll be dealing with parents that are growing older. So I think that American citizens would be so much better off, so much more prepared if we would plan just for growing older.
Now, would you say that the policies that you work with or that you help us to understand, would you say that they are helping us or kind of a bit of a hindrance?
Oh, absolutely helping us. So for example, the Affordable Care Act, right here on this campus, we have a great example of how the Affordable Care Act helps students. A provision in the Affordable Care Act allows students to be on their parents' employer-sponsored health plan. So as a result, students here may not have to buy the school-based health insurance, and they can go on their parents' policy, which could save the family money. So in my mind, that's a pocketbook issue. Anytime you can save money, you can immediately recognize that fact. Sometimes health policy isn't realized for years, and so when we look at issues of health disparities, we've been dealing with chronic disease and the fact that African Americans in particular have not realized real improvement in some of these conditions for years. So, for example, the Affordable Care Act addresses health disparities. The law puts money into ensuring that there are more residents, medical residents that practice primary care medicine, that there is more data collected as it relates to health disparities. So there are some real tangible ways that policy actually translate into help in real life.
Well, it's really wonderful to hear about all the different aspects of regulations and policies and how they can benefit us. Now, when we return, we're going to ask Dr. Roshell more about public policy and how she has played her role in implementing it. We'll be right back. Stay tuned.
Son, tell him that I've begun to dream of things to come, and tell the trees not to look for me. I'm going to find some peace of mind. Wake the sun. Wake the sun, wake the sun, wake the sun.
Oh, those boys are much too much. Those boys are much too much. We got the spirit, we're hot, we can't be stopped. We got the spirit, we're hot, we can't be stopped. We're gonna beat them and bust them.
The smallest moments can have the biggest impact on a child's life.
Let's get a little bit rowdy. R-O-W-D-Y.
Take time to be a dad today. Call or visit fatherhood.gov to learn more.
Packers. Viking. Packers. Viking. Viking.
Red state, blue state, vegan.
Carnivore.
We come from different places.
Uptown.
Downtown.
Optimist.
We come to different conclusions.
Half empty.
Half full.
But when we live united, we create real, lasting change in the building blocks of life. The education, income, and health of our communities,
Live.
our families,
United.
even the person next to us.
Live united.
Real change won't happen without you. So give, advocate, volunteer, live united. Sign up at liveunited.org.
What does it take to start something? A little time. A little exercise. A little laugh. A little adventure. A little help. That's all it takes to make a big impact.
As he always talks about, he had people in his life that really helped him out, and he wants to be that person in my life.
Just like he is, I was like that at 14. I know exactly what it means to be a 14-year-old guy.
I think that's why we have a good relationship.
It's fun and cool and nice.
You get to see like how personality develops.
Our friendship is good.
At Big Brothers Big Sisters, a little bit of your support can go a long way towards making matches like these happen. Start something today at bigbrothersbigsisters.org/startsomething.
Welcome back. Now, when we last left off, we were learning about the wonders, the different aspects of the Department of Health and Human Services. And Dr. Roshell was shedding light on some of the policies that she's even helped implement. Now, we're going to find out more about what you do, but one thing I want to ask that's kind of been tickling my brain, what kind of issues have you been faced with in dealing with public policy, maybe with dealing with the actual citizens that you are helping to understand about the different policies and regulations?
That is a great question. The Regional Director's Office really is the front door to the Department of Health and Human Services. We have 11 operating divisions, so the average citizen doesn't know where to go when they have an issue. So we take in any kind of complaints or concerns that one might have with Medicare. If they have an issue with anything that our department is responsible for, we help to connect those consumers to the right organization within our organization to get them the help that they need. What I hear a lot is that, for example, with the Affordable Care Act, there's so much misinformation. And so we really help individuals understand what the benefits are and what the true information is about the Affordable Care Act. We hear so many times that older adults in particular think that they will no longer have access to their Medicare because of the Affordable Care Act. So we help the average consumer understand the truth about what the law really is.
Yeah, lately there's been a lot of kind of myth busters going on.
Exactly.
Yeah, that we have to get clarified. So in dealing with that, where can we get the literature to learn more about it? Or, because I know older generations are kind of stuck in their ways as far as accessing information, but there are, resources that we can get at home. So do you have access to your information via the internet, maybe email, subscription, something like that?
Yes, we do have healthcare.gov, and there is listed a host of great materials on the Affordable Care Act. Then you have medicare.gov, which will give a consumer information about Medicare. For example, 1-800-MEDICARE. They can call 1-800-MEDICARE and get information about their Medicare benefits. And then we worked with so many wonderful community organizations that help us get the correct messaging out there. So a consumer can interface with HHS in a variety of ways, but we really are the front door to our overall organization, and we want consumers to contact us.
Wonderful. So I'm glad that you put that out there so you can be reached.
Yes, absolutely.
So another thing, over the break we were having a little dialogue about some other areas that you work with, and you mentioned, helping for the welfare of women. What can you tell me about that?
Well, a little known fact is that the Department of Health and Human Services is responsible for Head Start. For example, we work with wonderful organizations throughout our region to actually implement the Head Start program, which is a wonderful opportunity to give very young children their first formal introduction to education and to prepare them to be successful for the many years ahead that they have to be educated in our school system. We also deal with minority health, women's health. For example, in the Affordable Care Act, the law is really tackling preventative services, and under the law, there is no longer co-pays or co-insurance for many, many preventative services. And this is such wonderful news because many women put off things like mammograms and different types of screening because they don't have the additional money for the copay. So they may have health insurance, but in order to get a mammogram, for example, it may cost an extra $50 in a copay. And they put off these important screening services because they may not have the extra money. But due to the Affordable Care Act, because of the Affordable Care Act, there will no longer be co-pays and deductibles and co-insurance of that nature for preventative services. So it's a wonderful day for women because they definitely are the caretakers and have been responsible for health care decisions in families, so we want them to be healthy.
Wonderful, and it's great to hear that more than just medical doctors are trying to tell us to, or our insurance is trying to tell us to make sure you're getting these different exams. however, annually, biannually.
Yes.
I recently had just a physical with my doctor, and I asked him about how soon should I get a mammogram, and he said, oh, you got another probably 15, 20 years.
Yes.
But I was aware of asking these questions, so I know that that information is out because I'm aware
And
that
that's
I
so
need to
important.
ask these questions.
Yes.
So I'm
Very
wonderful
important.
to hear that. And then the Head Start, I never knew that.
Never knew that.
I was in Head Start.
Oh, yes.
And I loved it. I still remember my Head Start graduation.
Oh, yes. That is such a memorable time in Head
Yes.
Start. And some of the programs, or all of the programs, do an excellent job and absolutely just have a showcase for graduation. Is so important.
Yes, I have to say it really did give me that head start because I love school.
Yes.
If I could do this for the rest of my life for free, I would definitely do it. I love education and just learning, and
And
I'm
it starts
definitely
young.
Yeah, it does. It really does. And I have a 2-year-old sister, and I'm definitely gunning for the Head Start for her because she's so quick, and the children now are really smart.
They are.
And it's
They are.
because of all of the access to information that we do have. Every
Exactly.
household can have a computer in it.
That's right.
So we definitely need to put them in position for a good future.
That's correct.
So now, as far as your public policies and the different things that you are helping us to learn, what have you learned in your position?
Well, I've learned that what we think sometimes is easy to understand when it gets out into the community and across states, that you really do have to think about how you communicate differently so that, again, you can alleviate misinformation, so that you say things in a way that will give people the comfort to take action and to share the good news about how different policies and programs and services, how they work in their availability. No matter how much we use the internet and put things in newspapers and do wonderful interviews like this, word of mouth is always the best tool, because a consumer believes another consumer who has had a positive experience. And so we really love to engage our communities and stakeholders that really are wanting to get the correct information out about a variety of different programs and services.
Right. So dealing with community engagement, do you find it difficult to articulate amongst the different states or even the different regions? Do you find that sometimes your policies, it may be the same exact thing, but it's worded a little different just so they can understand it?
Absolutely. We have a focus on making sure that what we do and say has a cultural competence and is linguistically appropriate. So we definitely pay attention to how we say things and what is acceptable. So from the whole diversity umbrella, cultural competence is high in our priority area to make sure that our messages are received appropriately. And we rely on our community partners to help us with that. So yes, definitely within the Southeast, none of the 8 states are the same. They may have similar characteristics, but each one is individual, and we always want them to feel that they are receiving the individual attention and that they're recognized as an individual state within the region and not just a monolithic type of organization within our organization.
So have you ever noticed a cultural impact as far as the different policies that you do implement? Have you noticed that it has changed? Maybe a set group of people, maybe a state?
We do collect data, and we have some very good data to show that there are some gains in a variety of areas related to health primarily. So yes, we are able to see improvements, and we're very interested in continuing to collect that data so that we can tell the story from an impact perspective.
I believe you all are doing a great job at that. I'm originally from Tennessee, and when I noticed that that was one of the states that Region 4 covers, I did start to, remember about the different things that I've been seeing back home. I know that my church, we do more health fairs and career fairs simply for people in the neighborhood and the surrounding community to come out and learn more about what our country is doing for us. And we also offer the screenings for high blood pressure, diabetes, and things of that nature. I've been watching the news here in Atlanta and also national news about the trucks. Of course, they have food trucks, but now they're doing trucks that have, you can get your teeth clean.
Yes.
In the trucks.
Yes.
I just think that's absolutely wonderful. They're actually taking it out of the office and bringing it home to you.
Exactly. The community definitely is where individuals receive their information, where Americans work, live, and play. And so several divisions of HHS have very concentrated efforts as it relates to stakeholder and community outreach and engagement. And so we want to be a part of communities. We want to be a part of those trucks that go out and providing our information, and sometimes personnel to actually be there on the ground to explain and to be a part of the community's understanding.
Wonderful. And like I said, the impact is very real. I'm noticing it at my age, and I definitely want to keep that ball rolling. So whatever I have to do to make sure that these policies come back, that these laws stay in place so that we can help generations after us would be wonderful. And I definitely want to help in that aspect. As whatever I can do as a citizen, I definitely need to find out and do it.
Yes, shows like this are a great opportunity and something that may be of interest to your viewers, especially students. At HHS, we have a great internship program, especially in the public health field. So I really encourage students to go onto hhs.gov and cdc.gov to find out about fellowships and internships, to not only give them work experience, but to give them a taste of how we actually formulate policy and how we actually implement policy across the country.
Wonderful. So how can they access that information? Is it the same website?
Yes, hhs.gov or cdc.gov are two great websites that they can go to. If you go to HHS, just put in the word internship or fellowship. The same goes for the cdc.gov. Just put in the word internship or fellowship, and we have a lot of wonderful opportunities right here in the Atlanta area.
And opportunities is the perfect note to close out on this session, because we definitely all want to hear that door being answered after we knocked. I know our social work department here on campus is very astute. There's really honing in on the different values and things that they have to teach these students in order to get out there in the real world.
Yes.
Because that world is a bit differently than what we get to see every day.
It always is.
Yes. So I'm so happy that you came out and joined us. It's an honor for me to meet an appointee from the president right here on the show.
Well, thank you for having me. It's been a delight.
Thank you so much, Dr. Roshell. And thank you all for viewing. We hope that you did learn something interesting today about the Department of Health and Human Services. Now, as she mentioned, you can definitely go and find out about fellowships, internships, and career opportunities if you just log on to hhs.gov. Thanks for tuning in. Have a great one.